Today I have a guest. Her name is Narath Mendoza, and she is a chiropractor who specializes in pelvic health and pregnancy. A lot to learn here. A big problem with pregnant women having pelvic pain and back pain and hip pain after pregnancy. We're going to talk all about that. But more than that, Dr. Narath talks about how everyone should be really focusing in on their pelvic health, men and women. And she gives some really great action items on how we can do that. We actually used to work together, but she has been practicing for 12 years. So tell me a little bit about your story.
Well, after school, I started to work for a lot of doctors who were sports focused. And I became good at that, and I worked with a lot of athletes. But then I started to realize that, like, I was helping people, but I wasn't really making an impact. And then I had gotten pregnant and with my first baby. And during the pregnancy, I had a lot of pain, and it was a lot of pelvic pain. I asked my doctor about it. She was my OB, and she pretty much said, you know, like, a lot of women have this pain and you're just going to deal with it until the end of it. And I thought that was normal. So I was just like, okay, I'm just going to live with it. And then after giving birth, the pain just went away. But during the pregnancy, I had a hard time putting my pants on, a hard time walking, even like just bending forward was painful. And it felt like a stabbing pain in my pubic bone. But, you know, I was happy that the pain went away. But after the pain went away, I started to feel a little bit of back pain. But I thought, well, having a baby, you probably have back pain. So then goes on to the future where I have my second pregnancy, and the same thing came on. And I was kind of like, you know, I don't think this is normal. And I asked all my friends who had babies, and they're like, I don't think it is normal because we never had that when we were pregnant. So had the second baby, and then the pain started to kind of continue. I started to have more pelvic pain, and then I started having like tailbone pain. So I couldn't sit down like in church or anywhere for long periods of time because my tailbone would hurt. And then I started working where I met you.
Yeah.
And the physical therapist there. You remember her, right?
Yeah.
So she evaluated me, and she told me that that type of pain is not normal, and that some women do suffer with it while they're pregnant, and some will still continue to have it after pregnancy. So she looked at my core and told me that I had a lot of separation still in my deep core muscle. Now, most women will have that because you're carrying this like extra weight on your belly. And so your deep core muscle, they're going to separate. And eventually after pregnancy, it should come kind of back together. But she said that mine like kind of just stayed open.
And is that diastasis recti, or it's not even that? It's just the deeper muscle?
That was weaker, yeah.
Okay.
So diastasis recti, people call it different things. It's actually pretty rare. Women have that because they actually have like torn muscles. And a lot of women are told that they have it, that they have DR, but they don't. It's just that their muscles are weaker, and you can correct that. If you have DR, usually it's only like a surgical repair that can heal that.
Okay. And by the way, for people who don't know what that is, that's when the abdominal muscles during pregnancy just separate. And then you can actually feel that it's separated if you put your finger there.
Yeah. And it's not an actual muscle that's tearing, that's separating. It's like a rubber band. When you pull it, you overstretch it, and then it gets weaker. But you can strengthen that back.
Okay.
And that's the reason why women can recover from things like that. Some women like continue to have that kind of like the weakness there because they haven't retrained their core.
Okay.
And so that's where I come in.
Okay.
Where I help women to retrain that before they actually go and do things to actually train it, like doing planking, doing sit-ups, doing CrossFit, doing Pilates. Things like that shouldn't be done until you actually retrain your core first.
Okay.
So there's a difference between the two.
So once you have a baby, if you go straight into doing like CrossFit or all of those, it can be detrimental.
It can be.
Okay.
And, you know, there's plenty of women out there that can do things like that and never have any issues. but most of us will have pain later on, and they don't understand why they have back pain or tailbone pain, or why their coccyx feels like it's going up inside of them. And it's usually because of like a weakening somewhere after pregnancy.
Okay. So what did you do then after the second pregnancy? So you kind of went down this journey, and how did you repair your, or how did you address the pain there?
So the physical therapist had me doing core workouts, but she had me wearing kind of like a binder. So in Asia, when you've had a baby, you bind your stomach together. I didn't wear something that was like that tight, but she had me wearing kind of like a brace for my stomach, and then had electrodes put on there. And every time the electrodes would turn on, I would do a kind of like a crunch. And that helped me. It took a long time and it took a lot of effort, but eventually I became stronger. Even with that, I still had other issues like leaking and which is incontinence, right? And later on, after doing a little bit of investigation and finding other providers that taught these types of courses, I went to them and I learned that it's not just abdominal muscles that you have to work on. It's breathing technique, it's your pelvic floor muscles, and also your back muscles.
Okay.
And when I included all 4 of those things, then the continence kind of reduced and I felt a lot better.
Okay.
Yeah.
So not only pelvic pain, but the incontinence where you can't hold your urine in,
Yes.
basically, like after you have a baby and you laugh and
Yes. And yes.
So then that, really helped you. So then you started like incorporating this into your practice?
I a little bit. I just made women more aware of it.
Okay.
And when I knew someone was going through that, then I told them that they needed to find a pelvic floor physical therapist, and they would find someone around the area and then start seeing them. But then I wanted to start doing it on my own, like teaching my patients instead of like having them to go through all these different like providers, to just, if they come to me and they tell me about the pain, then I can help them.
Yeah.
So I started taking courses, and then I took about like 2 of them already. There's a company or like an institution that teaches all of this stuff, and it's taught by a physical therapist. But a lot of other providers go to those. There's like chiropractors, occupational therapists. There's even midwives that goes to these courses, and we learn a little bit more about it, and we can help them. If it's something that we can't help just by doing like exercises and internal massages or external massages, then we send them to the doctors.
I see. And that's so great, incorporating your chiropractic with this pelvic floor work. I think that's really great. So how has that worked in your practice? Has that changed who you're seeing now? Because you're seeing sports medicine people, that's probably like CrossFit guys and dudes and like really strong guys. And now have you shifted more to seeing pregnant women and postnatal?
Yeah.
That's so great.
Yeah, like my practice now, more than 50% of my patients who come see me are either moms that have had more than one child, or women who are pregnant and want to prep their pelvic floor muscles so that when they do give birth and they do have tears or lacerations, that they're stronger.
That's so great. I wish I knew about that when I was pregnant. Okay, so actually I have a question, because my sister just had a baby yesterday.
Oh, congratulations.
Thank you. And she had an at-home birth, completely natural, birthed in the water. It's really beautiful. And but so for her, so what would you suggest for her? So someone like her who just had a baby, what would be the steps she should take to now heal properly and make sure she doesn't have any, damage from the pregnancy, the labor, the delivery, etc.?
I would say start on Kegels.
Okay.
And if she starts noticing any back pain, any pelvic pain, any incontinence, that she starts to, like in other countries, the first thing that a woman does after giving birth is they have 6 months of PT or physical therapy. And it's a requirement that's made.
Really?
Yes.
What countries?
Everywhere except for the U.S. So they do it in Europe. So like a lot of French women that I've met who have moved out here, they're just wondering why they haven't been sent to a physical therapist to start working on their pelvic floor muscles.
Interesting.
So they're sent to a physical therapist. They work on pelvic floor muscles for strengthening because that can prevent you from having incontinence in your older years. And we all somehow get incontinence. I have patients who've never had a baby before who are in their 50s who have incontinence.
Right.
And it's hard for them because they could be at parties and laughing and then they just pee on themselves.
Yeah.
So for your sister, you know, if she has any of those pain, she can go to a website that I always go to for any questions, and it's hermanandwallace.com. And there's a search area where you can just put in like your questions, and it'll come up with a bunch of research paper that they've published themselves or information that they can find on the web.
Oh, cool. Yeah. Okay, I'll put that in the description if anyone wants to find that. And so tell me, you know, in terms of Kegel exercises, I feel like there's maybe different ways of doing it or whatnot. What is the type of Kegel exercise you suggest? Is there a way you describe it that someone can do it easily?
Yes. So a lot of times when you've gone to an OB or a gynecologist or an MD, they tell you to do Kegels where when you go to the restroom, you stop your pee, and that's your pelvic floor muscles. And I'm not really sure how they tell their patients how to do them, but I've had women come in and they say, oh, I just stopped my peeing, or like I squeeze really hard, and I practice it when I'm like driving. So with my patients, especially after having a baby, it's a muscle that's still healing, right? You've just pushed this baby out. And so I start off with just more of a relaxing way of doing it. So I have them laying on their back with their legs straight out or bent. I have them taking a deep breath in. So I also have to teach them how to do that. But when taking a breath in, most people will breathe only through their chest. And so I have them breathing in and creating internal abdominal pressure. So their belly should be sticking out. And so when they're breathing in, their belly should start growing, and then their chest starts to rise. And then as they're breathing out, I want them to slowly contract that same muscle that they use to stop their pee. So I have them envision a blueberry.
Okay.
So they have a blueberry in the opening of their vaginal canal and also their anal canal, and then they have to pick that blueberry up.
Okay.
So you're not going to grab it, right? So if they're picking it up like they're picking up a piano, excuse me, then it's too hard.
Okay.
So I want them to pick up a blueberry. And then as they're picking up that blueberry, their muscles are going to slowly contract. And as they're continuing to breathe out, I want them to pick that blueberry up to the top of their head. So it's going to feel like they're on an elevator.
Yeah, I like that. Because actually, when you do the one where you try to stop your pee, I feel like it's like very forceful.
It is.
Right? So you're saying that this should be more of like a more gentle than that.
Yeah.
Actually.
But there's a reason why. It's because our pelvic floor muscle is made out of 3 layers.
Okay.
And if you're doing the hard contraction, you're only strengthening the outside muscle.
Okay.
You want to do all of it. So that's the whole reason for doing the slow movement. So if someone can't envision that, I usually have them getting a device or like sometimes using a tampon and then practicing like creating a contraction around the tampon all the way to the top.
Okay. And so you would suggest this, I mean, for pretty much every woman then.
Every woman, yeah.
But during pregnancy, after pregnancy, and then as we age as women, we'll get incontinence as well too. And so for everyone, basically.
For everyone, yeah.
Okay.
Even men. Even men.
Okay.
So I have...
What will they envision?
I tell them to envision a zipper.
Oh, okay.
Closing up. And that
Okay.
usually works well with them because they can't do the whole blueberry thing.
Oh,
I do have male
interesting.
patients.
Okay. And men have pelvic floor dysfunction
They do.
too? And what would that look like?
They
Why does that
usually-
come about too?
So because we all either abuse like our pelvic floor muscles through stress, we clench a lot, and so our body's just used to always clenching. And clenching for some men, if they come into the doctor and they say that they have pain in their pelvic area, the first thing that the doctor's going to think is that they have like a inflammation of their prostate or something going on with their testicles, right? And with all the testing that they've done, all of like the blood work and the urinalysis and all that stuff, everything's coming out negative, but they don't understand when they have this pain. Sometimes it's your pelvic floor. Either you're like in a very high stress environment and you're always clenching, which a lot of people do that. or someone who just bears down really hard when they're going in the restroom, or they just don't have a lot of time and they're always sitting and they're holding everything in. So those men will come in and they have pelvic pain and they get misdiagnosed all the time. And I've worked with a lot of men who have these pains and they think that something's wrong. And everyone's telling them they're a little crazy, which they're not. They're actually really feeling something. So I've worked with helping them to learn how to relax those pelvic floor more. And if they come in with a weak pelvic floor, that can also cause that same type of pain. I'll work with strengthening it with them.
Oh, interesting. Okay, so even men should be doing,
Yes.
and theirs is more of a zipper.
Yes.
Okay. All right, so blueberry and a zipper. That's easy to remember. So then tell me how you combine the pelvic health work with your chiropractic.
So pelvic health is muscular and it's functional, but sometimes is neurological too. There could be a compression somewhere in their sacral nerve or their lumbar nerve. And if there is compression, that means that those organs are not working well, right? So I use chiropractic to help to just make sure that the nerves are working well and there's nothing that's blocking that area, so that as we're training and retraining their core, that they have nothing that's going to get in the way.
Okay. And so that's with chiropractic adjustments, etc.
Yes.
Okay.
So I do chiropractic a lot, but a lot of times I will send them out to an acupuncturist, which will help the person, and they'd put needles in areas that would affect the tibial nerve.
So then an acupuncturist kind of relaxes those nerves and then allows you to do more work in terms of adjustments.
Yes. Yeah.
Okay. Tell me what kind of patients are finding you now. So is it people are mostly finding you with pelvic floor dysfunction, or?
It's usually they come into me and I've had a lot of women just come in with tailbone pain or lower back pain. And when I do a little bit more of an investigation, I find that it happened after pregnancy or it happened during pregnancy. And as I'm checking them, I'm finding that they are weaker in their core and they're weaker in their pelvic floor. And that's when I start seeing more of those patients. And then it's a really good resource because women talk, and so they start telling all their coworkers about it or their sisters.
Well, I mean, if you can help some of those pains during pregnancy, I'm sure that's why your practice is growing in that way.
Yeah.
Because that's a really common problem, right? When
It
people
is,
are
yeah.
pregnant. So would you suggest people do this proactively? Like,
Yes.
should they go see someone and try to work on this just right when they know they're pregnant? They should now go see someone like yourself?
I would think so, yes. It's not always the case, but it helps if you've never worked on your pelvic floor before. For instance, if you're going to have surgery on your shoulder, what usually happens is you work that shoulder as strong as you can, and then you have surgery. And so if you know you're going to have a baby and the baby's going to be coming out, like, you want to work that pelvic floor muscle so that's strong, right? So because in every birth, there's going to be some laceration, there's going to be weakening of that muscle. And it's much easier to come back from being strong at first and then having to repair it than being really weak and going in and tearing it, and then it's even weaker.
Right.
Yeah.
So important to be proactive.
It is. And I've had a lot of patients tell me that their pregnancy was much easier. It was easier for them to push. They didn't have any problems.
Yeah.
And then with women who've had second and third pregnancies who've never seen anyone for it beforehand, said that it made a huge difference on their second and third pregnancies.
So even the labor and delivery part of things is so much easier. And I'm
Yes.
sure the healing is much faster too.
It is.
Okay,
Yeah.
so it almost seems like a no-brainer.
Yeah.
We all should be doing the blueberry. And so what else? Are there posture things? Are there lifestyle things that we're doing to degrade this area faster?
Yes, because your pelvis there's so many things connected to it, right? Your pubic bone is connected to your transverse abdominis muscle, which connects all the way to the top of like where your xiphoid process is. And then you have all your glute muscles that are attached to the pelvis, your SI joints and like your iliums. When we're pregnant and our bellies are growing, our pelvic tends to tilt forward. And if it tilts forward, then there's a change because the muscles in your pelvic floor muscles also has to change. And if we carry more weight in the front, then that means that we're going to create more compression in the back. And that could be causing a lot of women to have back pain when they're pregnant. And so making sure that you have good posture, keeping your belly close to your body. So that's the reason why when women come in and they have back pain, I usually have them get a sacroiliac belt that they wear, but it's one's for pregnancy. And so it helps to kind of cradle the belly closer to the body. And that will take away a lot of pain.
Okay.
If women complain of pubic bone pain like I did, if I wore a belt because someone told me to, it would have taken the pain away.
And do you have one that you really like that you would suggest?
I just go on Amazon.
Okay.
Yeah, they have so
and
many
it's
different
called
ones.
a sacroiliac belt?
For pregnancy.
Okay, for
Yes.
pregnancy.
Yeah.
And if you're not pregnant and you're saying that over time these pelvic floor muscles do also get weaker, is there something lifestyle-wise or even posture-wise that everyone should be doing?
Always just keeping your pelvis neutral,
Okay.
right? And because a lot of people like either stick it out or stick it posteriorly because they sit down and they slouch. So just keeping
So
your
really just having good posture
Yes,
is
yeah.
important.
Yeah.
I like to say before when I was working with pregnant women a lot, in a capacity of I was teaching them actually how to dance. I would tell people to pretend there's a string on your belly button and you're pulling actually towards the back.
Yes.
But it's just really gentle. It's not like you're like really,
Yes.
but you're just like pulling gently. That there's always a string there pulling your belly in towards.
Yeah, I've used the same thing.
Okay.
Before,
Yeah. And I think that's really helpful. Okay, great. In all of your time as a chiropractor, now doing pelvic health, working with pregnancy, what are some action items that you found that can be really helpful? Things we can do every day, just everyday things that we can do to make sure that we're healthy.
When it comes to pelvic health, things that we do to our organs, which is the bladder, the uterus, and the rectum, like that makes a huge difference. So if we're always irritating our bladder with drinking a lot of coffee or alcohol, then that means that we have a higher chance of getting infections, right? So chronic infections can cause you to have weaker pelvic floor muscles. So making sure that you're staying hydrated, and you don't want to drink like a 32 ounce of water all at one sitting. That puts a lot of pressure onto the bladder, and that puts a lot of weight onto your pelvic floor muscles.
That makes sense.
So you want to make sure that, and you're supposed to be going to the restroom throughout the day, but if you're constantly going, that's another reason why we have pelvic floor weaknesses, because we're constantly going all the time because we're just putting too much weight into the bladder. So sipping water throughout the day, and making sure that when you drink coffee or you're drinking tea or drinking alcohol, to make sure that you also replenish with water too. And that will just kind of dilute the bladder, the urine a bit, and so it doesn't irritate it as much. And then eating, like if you know that eating hot Cheetos is going to make your stomach hurt, that's another thing. Like try not to force, because if that happens, right, or you're constantly constipated or eating things that are irritating your digestive tract, like that's going to cause you to either have constipation or have a lot of like diarrhea, and that can cause you to have a weak pelvic floor muscle too.
That makes sense. So yeah, that's really important. And then I think you mentioned something when we were talking off the mic, but about stress and how stress can also affect that area. So tell me a little about that.
So because stress turns on your sympathetic nervous system, your body is going to clench. It doesn't just it's not just a symptom of your psyche, it's also a physical thing, right? And so you clench your jaw, you clench your shoulder. That's why people feel like their shoulders are always up to their ears. But another part is your glutes. So when people are stressed out, they clench everything. I don't know if
It's true.
So yeah, right? So sometimes when I'm having a stressful day, I take a deep breath in, and when I relax, I'm like, wow, my whole body has been like tense, right? But clenching can also cause you to have issues with, when women have issues with retention, where their muscles are so tight that they can't fully void, they may have to practice some more relaxation or meditation where they are not always clenching.
Okay. So action items would be women should be doing the blueberry.
Yes.
Men should be doing the zipper, drinking a lot of water, but not all at once, sipping throughout the day, and then de-stressing, because when we stress, we really clench our muscles, and that will affect the pelvic health as well.
Yes.
Okay, great. Well, I think those are, these are things I actually didn't know as well, too. So I'm really glad we had this chat. And if people have more questions and want to reach out to you, maybe they're local or maybe they just want to ask you questions, where can they reach you?
They can email me. They can email me at Dr. Naroth, which is DrNaroth, at BeFreeLiveWell.com. Or they can just go to my website, which is BeFreeLiveWell.com. And I also have an Instagram page where there's also my information on there too. And I think it's Dr. Naroth.
And I'll put all of that in the bio. But Dr. Naroth is really nice to give her email. And I think that a lot of people have questions about this. I think it's a really common problem. And even I didn't know a lot about some of the things you've mentioned today. So I think that's really great. And I'm going to take that to my practice too and definitely be forwarding people along to you, including my sister.
Yes, bring it on.
Yeah, because I think that that's so important. And, having a baby myself 10 years ago and, having to work on some of that myself, I think, and my patients, a lot of patients will say, oh, well, I had this pain, that pain ever since I had my baby.
Yes.
And now I'm thinking, I should definitely send them to you. So great. Thank you so much for joining us today.
You.
Really enjoyed it. And everybody, thank you for joining us in our chat today at Getting to the Root Cause. We are on YouTube. It's Getting to the Root Cause with Dr. Fong, and we're on all podcast platforms.